What is a typical treatment day like at CFS? And I know it's around 3 to 5 months of a length of a program.
Sure. Yes, yeah. So each day when our clients arrive, we have kind of a morning track and then an afternoon track, and our groups are split up by gender, but also developmental functioning. And it tends to be more of like a middle school age range group and then a high school aged ranged group. But again, based on developmental functioning. And so when our teams arrive on site each day, we're going to start with an emotional coping skills group. So our teams kind of do a check-in. How have things been since we saw you 21 hours ago? Any like crazies that we should be aware of or significant conflicts? And just in general, like, how are you doing today? And then we teach them an emotional coping skill so that they can just kind of have a skill in their back pocket for the rest of the group, for the rest of the day, and then hopefully beyond today as well, something that they can carry into the future. For our second hour each day, we do a therapy group. Our therapy is primarily cognitive behavioral therapy. We also are DBT informed, trauma focused. Most of our providers here have been trained in trauma focused cognitive behavioral therapy. So being able to integrate psychoeducation, but also understanding how our thoughts and our feelings in the present moment are impacting us and how those might be related to past experiences or future anxieties. Those are things that we're going to talk about in that therapy group. And we also give teens an opportunity to process with one another kind of conflicts or concerns that they might be having in their own life. We know that teens are often really drawn to receiving peer support, which is developmentally appropriate, but being able to be in a process group setting allows for a therapist to be present and navigate some of those conversations as well. I know for myself as a therapist, the teens are always like, come on, Caitlin, but I add in, like, okay, so this is the pattern that I'm seeing play out right now. And this sounds a lot like what you went through last week. Let's talk about how we can cope with this better. So just being able to insert psychoeducation in maybe a way that's a little bit more friendly to teens is something that we really strive to do here as well. And then our last group of the day is going to be a social skills group. And so we know that anxiety, depression, trauma histories, they can definitely impact how we interact with others in the world. And so that last group, we always teach us a specific social skill and then give teens kind of more of a playful opportunity to practice that, whether that be in a role play or a game, or a conversation setting, some sort of activity, but an opportunity to practice those social skills that they learned that day. That's what groups looks like. We also have individual and family therapy that are integrated into treatment as well. So a teen is going to have at least one individual session each week, and then family therapy can occur inside or outside of day treatment hours. For some providers here, they might be saying, like, I have a family that will not do family therapy. We're obviously going to recommend family therapy for most family systems. However, if a family chooses to not engage with that, we're going to do our best to offer them parent support. But that's not necessarily a rule out for treatment if the family system is not actively willing or engaged to participate within the family therapy.